Assalamualaikum everyone. Today I'm going to provide information about the 𝚂𝚂𝚁𝙸𝙸𝙽 tract and the disease that relates to 𝚂𝚂𝚁𝙸𝙽 tract lesions. That's name is 𝚂𝚂𝚁𝙸𝙽. And first of all, look at this spinal cord section, and we can divide 𝚂𝚁𝚁𝙸𝙽 tract into two types. First one is lateral 𝚂𝚁𝚁𝙸𝙽 tract, and second one is anterior 𝚂𝚁𝚁𝙸𝙽 tract. Yeah, and both of them carry different informations. First one, lateral 𝚂𝚁𝚁𝙸𝙽 tract carries the information about pain and temperature. Second one, and small one, anterior 𝚂𝚁𝚁𝙸𝙽 tract carries information crude touch and pressure. Okay. First neuron is pseudounipolar neuron. Peripheral fibers carries this kind of information about the pain, temperature, crude touch, and pressure to the pseudounipolar cells, and central fibers carries this information to the second neuron. There is a synapse in the gray matter of the spinal cord, and after synapses, this information carried to the 𝚂𝚁𝚁𝙸𝙽 tract. Before getting the 𝚂𝚁𝚁𝙸𝙽 tract, these kind of fibers have to cross the anterior commissure. Okay? After passing the anterior commissure, they pass away in the 𝚂𝚁𝚁𝙸𝙽 tract. That's the lateral 𝚂𝚁𝚁𝙸𝙽 tract, that's the anterior 𝚂𝚁𝚁𝙸𝙽 tract. Look at there is special and important point, and the location of these fibers according to the parts of the body. That's cervical part, that's thoracic part, and that's lumbar part, and that's sacral part. Okay? All of these kind of parts of the body, informations from this kind of parts of the body carried in these special parts of the 𝚂𝚁𝚁𝙸𝙽 tract. And this fiber directs to the thalamus. Look at that, that's thalamus. In this part of the central nervous system, in the thalamus, the third neuron can be initiated. The third neuron fibers direct to the hemispheres. As I mentioned above, and the hemispheres located different parts of the body. The areas that are responsible for analyzing some kind of information that are taken by different parts of the body. Look at there, that's sulcus centralis, and anterior part is precentralis gyrus, and the posterior part is postcentralis gyrus. Postcentralis gyrus is responsible for sensory system. Okay, this is the picture of the homunculus, and all of the parts are responsible for special parts of your body. And all of the information conducted to special hemisphere parts, and in this part, this kind of crude touch, pain, temperature informations analyzed. Okay? And the second part of our lesson about the clinical consideration of the 𝚂𝚁𝚁𝙸𝙽 tract, and you can find out there is the spinal cord cervical part. And in the cervical part, when you watch some kind of imaging techniques, for example MRI or computer tomography, you can find some kind of picture in the tomography or magnetic resonance image. That's the pelvic part, and it means that this part is filled with liquid. Okay, and the special disease of the 𝚂𝚁𝚁𝙸𝙽 tract is according to the enlargement of the central canal. Okay, central canal enlargement can impinge on the conduction of this kind of pain and temperature information, and the patient suffer from loss of temperature and pain sensation bilaterally on the right side and on the left side. Okay, there is a point, because one of the main reasons for bilateral lesion is two fibers crossed in the anterior commissure. Okay, anterior commissure is most susceptible when the central canal enlarged. Okay, when the central canal enlarged, it can compress the anterior commissure and it can stop the conduction of this kind of pain and temperature impulses from the right to left and left to right. Okay, and all of the clinical picture, it depends on this fibers conduction, and the patient cannot feel any pain and temperature sensation according to the site of the lesion. I have one information about that. The 𝚂𝚑𝚾𝙸 can happen and can take place any part of the spinal cord, but the cervical part of the spinal cord is most prominent part that can be damaged due to 𝚂𝚑𝚾𝙸. Okay, all of the necessary and useful information that relates to our lessons is all. Thanks for listening and watching.